Let's go now to our field reporter, Laura Windsor, as she gets some information on kids and food allergies.
Roger, food allergies are common, affecting about 6% of children and 2% of adults. However, they are often misunderstood. We asked Dr. Joshua Gibbs of Children's Hospital of Orange County to explain which foods are commonly known to cause allergies in children.
Food allergy is a term that describes an immunologic reaction to a food protein. Typically, they're proteins that are found in common foods that we eat in our everyday lives. And most people can actually tolerate those foods without any difficulty. But there's a subset of people that will actually develop an abnormal response in their immune system towards a component of the food. Most of the common foods, such as milk and egg allergy, most people will grow out of by roughly school age, and some reports are conflicting on that, but most kids will outgrow those allergies. Unfortunately, things like peanut, which is the one that's obviously got a lot of attention, only about 20% of kids will outgrow. So many people will have persistence of peanut allergy into adulthood. When it comes to the risks of food allergy, it really can be life-threatening. And I would say in most cases it's not, but there's definitely deaths every year due to food allergy. And it really has to be taken very, very seriously. And that goes for all the foods. There are certain foods that are definitely more likely to induce a life-threatening reaction than others. And I think when it comes to nuts, when peanuts and tree nuts, we really all worry significantly when we see patients with those allergies, because they tend to be pretty severe. But we take them all very seriously, and when it comes to patients who have had systemic reactions, we like to make sure the parents are equipped with adrenaline or epinephrine to treat any acute reaction. Yeah, as far as the symptoms to look for, it really varies. So, as I was mentioning, typically you're going to get some kind of skin reaction, and that's probably the most common place to get a reaction from food allergy. And that's going to range from hives, angioedema, which is just a fancy word for swelling episodes, and that could be of the lips, of the tongue, and that can progress to the throat and potentially occlude the airway, which is obviously a big concern. You can also, as I mentioned, have a worsening of already existing eczema in some of these children. If they eat a food that they're allergic to, the eczema can flare pretty significantly. So those are some of the skin manifestations. Other things that can happen is after ingestion of the food, upwards of even 2 hours later, you can get vomiting, abdominal pain, because this is an allergic reaction that can be occurring in the GI tract as well. You can get, in the most severe sense, you can get low blood pressure, respiratory failure. If a patient has asthma in addition to it, which is common since they're both allergic diseases, the asthma can also flare, so you can have people present with an asthma exacerbation. So those are probably the most common symptoms to look for.
Is there a treatment for food allergies?
Unfortunately, at this point, when it comes to treatment, we're looking at avoidance as the mainstay of therapy. So what we do is once we determine that a child has a food allergy, is we recommend avoiding that food. And almost always we want to retest the patient at some point down the line. And typically I'll wait about a year or so once I determine someone has a food allergy to repeat a testing. And whether that's skin testing coupled with blood testing, that's really on an individual basis. But at this point it's really avoidance of the food once the manifestation of the food allergy has occurred. And then you hope that over time the patient will outgrow that.
If you suspect your child might have allergies to food, getting them tested early can prevent reactions. I'm Laura Windsor for the American Health Journal.